How can this be happening? I did everything right. I don't understand. Why my baby? These are a couple of questions a family member can ask after losing their baby to premature birth. A baby born before 37 weeks is considered premature. Premature birth is the #1 killer among babies. Around the world, 15 million babies are born prematurely. And out of that 15 million, 1 million will die, according to marchthedimes.org. Today, I'm asking you for your help to dramatically lower that number. And with the help of the March of Dimes, I think we can. This organization is geared towards helping family members have healthy, full-term babies. Every baby deserves a fighting chance, and it's up to us to give them that chance. After several years of increasing prematurity birth rates, that rate is finally starting to decline. As stated in the World Health Organization, in lower-income countries, the prematurity birth rate is at an all-time high at 12%. But because of organizations like the March of Dimes in the United States, the birth rate for prematurity is at an all-time low, which is only 9%. Premature births can cause serious health problems for a baby. According to CDC.org, babies not carried to full term can have vision, hearing, and developmental problems. The average medical cost for a preemie baby is $50,000. But on the other hand, for a healthy baby, it's only $4,000 a year on average. The March of Dimes is a non-profit organization that requires funding from the public to thrive. The March of Dimes organization is in all 50 states, including Puerto Rico. That means funding is at its all-time high. Along with more fundraising, the March of Dimes also needs more volunteering to run the programs across the states. Without sufficient donations or volunteers, the organization would be forced to shut down. It is up to people like me and you to make sure that this doesn't happen. Donations of any kind can help improve the research centers around the U.S. These centers are used to discover prevention and treatment plans for premature birth. According to prematureresearch.org, the donations already made have allowed scientists of the March of Dimes Research Center to find multiple new factors that can cause prematurity, including microbial communities, sleep patterns of the mother, metabolic processes in the placenta, and genes. Due to the extensive research of the March of Dimes scientists, the preterm birth rate in the United States has fallen for the 6th consecutive year in a row. More money would also allow the organization to spread the word for many unfortunate countries and how to prevent early births. Members of the organization could travel around the world to less fortunate countries to help promote programs and practices to help save the lives of many premature babies. The new discoveries of premature prevention made possible by the March of Dimes has saved the nation billions of dollars in active health care costs. Right here in Augusta, Georgia, there is the annual March of Dimes walk. This walk is successful for raising thousands of dollars to donate to the March of Dimes organization. This helps the organization continue to help families in need. Imagine if this organization only cuts the premature birth rates in half. That means over 7 million babies can be carried to full term, very likely saving their lives in the process. I also want you to imagine if you had a baby that was at risk of being born prematurely. What would you do? I imagine you would want help and knowledge of someone or something that can help save your baby's life, which the March of Dimes can. Now, imagine if we didn't have the March of Dimes. Prematurity would continue to stay the #1 killer of babies. The rates in prematurity would go up, causing death rates to rise also. Also, less people would not know how to be educated on how to possibly prevent premature births. That is why we need to do our job and to make sure that that doesn't happen. So when you get the chance, I'm asking you to donate to an organization that can save something so innocent. No donation is too big or too small. Any amount can help enhance the futures of the March of Dimes organization. You can give a one-time donation or set up a monthly donation plan. You can donate over the phone, by mail, by fax, or online. There are other ways to help out this organization though. If you don't have the extra money, you can simply donate your time. You can become a March of Dimes volunteer, like I have in the past. Every year around the United States, the March of Dimes holds annual walks. These walks help raise awareness of the seriousness of prematurity. Along with raising awareness, it also helps donate money to the organization. You can be a volunteer that works at one of these walks. And if you don't have the time or the money, you can just buy one of these t-shirts. I bought this t-shirt, but mine says volunteer on the back. Of course, yours wouldn't say that unless you're a volunteer. All proceeds of these t-shirts go to the March of Dimes organizations. November is Prematurity Awareness Month, and November 17th is World Prematurity Day. But with the help of me, you, and our community, we can help spread the word of the seriousness of premature birth and make every day an awareness day for prematurity births. I have volunteered and I have donated. Now it is up to you to help. Only we can make a difference. Every baby deserves a fighting chance, and it's up to us in the March of Dimes to give them that chance. But without adequate funding, the March of Dimes cannot do its job. Please join me in continuing the help of the families in need, and not only in the United States, but around the world too. Thank you for listening. And this is my audience.